If money is your hope for independence, you will never have it. The only real security that a man will have in this world, it is a reserve of knowledge, experience and ability. A very good morning to everyone present here. It's my great pleasure to extend a warm welcome on behalf of Department of Psychology. I welcome all to Dhishana 2021. A multidisciplinary international webinar series organized by KSHEC College, Valancheri, associated with Kerala State Higher Education Council. Today's session is on psychoanalysis by renowned clinical psychologist Dr. Abdul Salam sir. So please cooperate with us by muting audios and avoiding other disturbance. Now let us begin the session by prayer.
ദൈവമേ കാത്തുകൊള്ളുകങ്ങ് കൈവിടാതിങ്ങു ഞങ്ങളെ നാവികൻ നീ ഭവാദിക്ക് ഒരാവിവൻ തോണി നിൻ പദം ഒന്നൊന്നായി എണ്ണി എണ്ണി തൊട്ടെണ്ണും പൊരുളൊടുങ്ങിയാൽ നിന്നിടും ദൃക്ക് പോലുള്ളം നിന്നിലസ്പന്ദമാകണം അന്നവസ്ത്രാദി മുട്ടാതെ തന്നു രക്ഷിച്ചു ഞങ്ങളെ ധന്യരാക്കുന്ന നീയൊന്നു തന്നെ ഞങ്ങൾക്കു തമ്പുരാൻ ആഴിയും തിരയും കാറ്റും ആഴവും പോലെ ഞങ്ങളും മായയും നിൻമഹിമയും നീയുമെന്നുള്ളിലാകണം നീയല്ലോ സൃഷ്ടിയും സൃഷ്ടാവായതും സൃഷ്ടിജാലവും നീയല്ലോ ദൈവമേ സൃഷ്ടിക്കുള്ള സാമഗ്രിയായതും നീയല്ലോ മായയും മായാവിയും മായാവിനോദനും നീയല്ലോ മായയെ നീക്കി സായുജ്യം നൽകുമാര്യനും നീ സത്യം ജ്ഞാനമാനന്ദം നീ തന്നെ വർത്തമാനവും ഭൂതവും ഭാവിയും പേരല്ലോതുമൊഴിയുമോർക്കിൽ നീ അകവും പുറവും തിങ്ങും മഹിമാവാർന്നനിൻ പദം പുകഴ്ത്തുന്നു ഞങ്ങളങ്ങ് ഭഗവാനെ ജയിക്കുക ജയിക്കുക മഹാദേവ ദീനാവനപരായണ ജയിക്കുക ചിദാനന്ദ ദയാസിന്ധോ ജയിക്കുക ആഴമേറും നിൻ മഹസ്സാം ആഴിയേ ഞങ്ങളാകവേ ആഴണം വാഴണം നിത്യം വാഴണം വാഴണം സുഖം.
Now I invite Ms. Sikhi, Assistant Professor, Department of Psychology, for welcome speech.
Very warm good morning to one and all present here. I am Sikhi, Assistant Professor, Department of Psychology, KSHEC College, Valancheri. I welcome you all to the Dhishana 2021 Multidisciplinary International Webinar Series in association with Kerala State Higher Education Council. Firstly, I welcome the eminent speaker of today's session, Dr. Abdul Salam, clinical psychologist, New Zealand. A warm welcome to you, sir. We have had the continued support of our principal throughout Dhishana 2021. I proudly invite our honorable principal, Dr. Anil Visa, to this section. Welcome, sir. Next, I welcome Ms. Krishna Prabhakar, Head of the Psychology Department, who was so active throughout this event. I welcome you, ma'am. Now, I would like to welcome Dr. Jidin M, convener Dhishana 2021. His hard work and dedication helped to take the event to a whole new level. I welcome you, sir. Next, I welcome Dr. Fawda Ibrahim, IQAC Coordinator, KSHEC College. She plays a very important role in perfecting the event. I welcome you, ma'am. The most important part of this webinar are participants. The participants of the program include faculty members and students from various colleges and universities all over India. On behalf of KSHEC College, I invite all the participants to the program. Enjoy the section. Thank you.
Next, I invite Ms. Krishna Prabhakar, HOD of Psychology Department, for presidential address.
Thank you, Dhishana. Our Honorable Chief Guest, Dr. Abdul Salam Sir, Respected Principal, Dr. Anil Sir, and our convener of Dhishana 2021, Dr. Jidin Sir, IQAC Coordinator, Dr. Fabida Ibrahim, our esteemed colleagues and dear participants, a warm good morning to you all. First of all, I would like to appreciate all of you for being part of today's international webinar. Today's presidential address starts with a question. The question is, what made you attend today's international webinar? You can post your comments in the inbox. Grabbing knowledge. I'm waiting for more comments. Learning something new. Okay. Okay, thank you all, because it is Salam Sir and psychoanalysis. Really excited to know more about psychoanalysis, guest of a program. Thank you all. So there could be many reasons that make us attend a seminar, especially in the case of webinars. There is a tremendous increase in the number of webinars nowadays, right? But I think the main reason that made all of us to attend today's seminar is definitely the topic psychoanalysis and our resource person, Dr. Abdul Salam Sir. So when I talk about psychoanalysis, we all know that the trained individuals in psychoanalysis are very few in number. And we know that there is difficulty in accessing psychoanalysis within our national health scheme. When I talk about Dr. Abdul Salam Sir, he has been using psychoanalytic techniques in his clinical work since 2015. He's such an expert in psychoanalysis. He's a coordinator of RCI recognized MPhil clinical psychology courses 3 years before. And he was the head of the department of IMHANS, Institute of Mental Health and Neurosciences, Calicut. And he completed his PhD and MPhil from Bangalore, NIMHANS. So it is definitely a privilege to have such a wonderful person as our guest today. I know that you all are curious about today's session, so I am not extending my speech. Make use of today's opportunity. All the best. Thank you so much.
Thank you, ma'am. Now let's look into a brief profile of Dr. Abdul Salam Sir. Dr. Abdul Salam completed his master's from Barkatullah University, Bhopal, and subsequently did his MPhil and PhD in clinical psychology from NIMHANS, Bangalore. He was involved in clinical practice and research at Sevana Hospital, Patambi, after his PhD for 3 years, after which he became an associate professor and head of the Department of Clinical Psychology at IMHANS, Government Medical College Campus, Kozhikode. He was a coordinator for the RCA recognized MPhil clinical psychology course for 3 years, there before moving to New Zealand. In New Zealand, he works as a clinical psychologist with the county's Manukau District Health Board, South Auckland, in their community mental health team. He got trained in psychoanalytic approaches to clinical interventions from Tara Clinic, Kozhikode from 2015 under Malika Verma and Dr. Ajay Vijaykrishnan, with whom he was associated for 3 years. He has been utilizing the psychoanalytic and psychodynamic frameworks in his clinical work since 2015 and is currently enrolled for the Intensive Psychoanalytic Psychotherapy program with the W.A. White Institute, New York. We welcome you, sir.
First of all, thanks for inviting me over. It's a bit of an odd time here in New Zealand. It's 7 in the evening, so yeah, and it's quite nice to, of course, talk about my favorite subject, psychoanalytic and psychodynamic approaches. of course, you could probably see the difference in the title. I'm not saying psychoanalysis. I'm talking about psychodynamic psychotherapy. So we can start from there. Okay. Now, psychoanalysis is traditionally, in fact, there are minor differences between these terms, largely differences in terms of the structural aspects of it. Psychoanalysis is usually done in the form of 3 to 5 sessions in a week. So usually analysts would work from Monday to Friday. So it's usually 5 days in a week. So that would mean every day. And the patient would come in for the session every day, discuss their life, and yeah, that's how it goes. And it's usually on a couch. And I'm sure most of you are familiar with the couch. The idea is that the person lies on a couch and the analyst sits near the head of the person, and the person just stares upwards at the sky, at the roof, and then says whatever comes to their mind, and the analyst would sit and interpret their issues and find out what's going on in their unconscious. That's the idea. Now, psychoanalytic psychotherapy, it would be a bit different from that. It's usually in the form of face-to-face sessions, which means that you would sit in a chair. The patient would also sit in a chair, and you are having a session face-to-face as you normally would have any kind of conversation. And usually these are once in a week, while psychoanalysis proper is usually a minimum of 3 sessions in a week. Psychodynamic psychotherapy is not different from psychoanalytic psychotherapy. It's just a word which started getting popularized when psychoanalysis started having a lot of stigma around it. So some politically minded smart academicians started using the word psychodynamic so that people don't get threatened by hearing the word psychoanalysis. So that's the so the difference is only in terms of structure. It's not really in terms of theory or practice. Yeah. So that's where. So I'm not really a psychoanalyst, as was disclosed in the introduction. I'm a clinical psychologist. So you could probably at the best describe me as a psychodynamic or psychoanalytic psychotherapist, because I utilize these ideas in my work. But for me to call myself a psychoanalyst, I would have to practice in the form of 3 to 5 sessions in a week, and having my patient on a couch. I have never had a patient on a couch. It's all face-to-face sessions. Right, so that's about the initial part of it. I hear that some of the participants already kind of know me, but I'm just gonna assume that you are all completely new to psychoanalysis. That's the easiest way to handle a seminar. But bear with me if it's repetitive for you. And you could stop me anytime if you want to ask questions. Now, when we talk about psychoanalysis, we are usually talking about people who are not very familiar with psychoanalysis would talk about psychoanalysis as if it is just one psychoanalysis. But if you enter psychoanalysis, you would understand that there are many forms of psychoanalysis. So immediately the question arises, what kind of a psychoanalyst are you? Are you a Freudian analyst? Are you a Kleinian analyst? Are you Winnicottian? Are you Lacanian? So there are many forms of it. I would identify myself more with intersubjective and Lacanian kind of practice, but I use ideas from all schools of thought whenever required. I started with Kleinian approach and gradually started to integrate Lacan and intersubjective approaches into my practice. I'll give you brief descriptions of what these approaches are. Of course, most of you are familiar with Freud. Freud began the whole thing of psychoanalysis. What he found was that when you allow people to just talk freely, you inadvertently end up talking about your childhood. If you do not block the person's conversation, no matter how old the patient is, no matter what the patient's presenting symptom is, if you just allow the person to just freely converse, and that's where his idea of free association came from. So that was his major discovery, which kind of led him to think that childhood must be really important for all of us, and that's where this whole thing of therapy started. So of course that is Freud. Now Freud's childhood is a broad definition. He would consider till 10 years or 12 years as childhood, and anything which happened at that age he would consider very important and affecting your entire life. While Melanie Klein, she kind of reduced that age bracket and she reduced it to 2 years. So her idea was what the child experiences till 2 to 3 years of age is what is most important, and that gets repeated throughout the life. And that's why if you guys remember the research done by Lawrence on imprinting, and he did it on animals, there is a particular period right after birth when anything that happens to you gets imprinted in your brain, and it's difficult to erase and delete those informations. So she said for human beings that kind of a critical period is till you attain 2 to 3 years of age. So what will happen with you till then is what's important. So things like, did you get breast milk when you actually wanted, or did your mother just ignore you and gave milk when she thought it was okay to give you? Or were you given a hell lot of breast milk, for example, more than you actually wanted because your mom just liked to feed you? Was your father present at all in this scenario or not? So those kind of things. Or did your mom attend to you? When I say mom, it could be anyone who is playing the role of the mom. It could be an aunt, it could be a caretaker in a hostel, it could be anyone who is playing that role. It may not be even a female, it could be anybody. So, like for example, when you cried, did your mother attend to you or not? So these things, she said, would affect your adulthood. Winnicott kind of came in, and his importance is that he brought in the idea of fantasy play, and he talked about the fact that you need fantasies to understand reality. Incidentally, I was listening to your prayer, and it had a mention about Maya, and Maya is a very, very close concept to the idea of fantasy by Winnicott. And he says, without fantasies, we would not be able to appreciate reality. So fantasies are very essential. And he's the one who started talking about the importance of play for children. And he observed that children who didn't play was unable to communicate and was unable to be well integrated adults in later life. Like, for example, if you think of an adult who is unable to play. Now, when I say play, I'm referring to the ability to entertain fantasies. For example, I have had some people who watched Bahubali and said it was a stupid movie. How can you bend a palm tree and send a person, off from the palm tree like that? Now, bending a palm tree is impossible. Now, a person like that watching a film is useless. There's no point in that person watching a film. So the ability to entertain fantasy, the ability to kind of suspend our reality checking, that's what we do when we enter the movie theater. We suspend the idea of reality for some time and till we get out of the theater. So that ability is important. Otherwise, you wouldn't be a well-integrated adult. That was Winnicott's idea. So Winnicott used a lot of play in therapy, and he introduced the idea of squiggle games in therapies. Kohut was the next person who made a major impact. He talked about the idea that when you can only develop with the help of somebody else. So it is always in the context of a relationship. And he said that, for example, if I, as a baby, I cry because of some discomfort in my stomach. Now my mom comes in and she says, oh, you're just hungry. And then she feeds you. And then you find that your discomfort is gone. Now that's how you learn to label hunger, right? So that's an example. So you need your mother to tell you what it is that you are feeling. So for you to understand yourself, you need the other person. And Kohut says that can happen only if the parent is really attuned to the child's needs. If the parent is unable to understand the child's needs, there would be a mismatch, and that is what leads to later symptoms. And his idea of therapy was to create an environment in the session where you can go back to that childhood age where you got stuck with this mismatch in between you and your parent, and so that you can kind of match that and restart the progress of development. Now, in psychoanalysis and in any literature related to psychoanalysis, what you need to keep in mind is that when psychoanalysts talk about parent and child, immediately you should think of therapist and patient. That's the idea. The idea is that the therapist is the parent for the patient. So when we say, like in Kohut's framework, when we are talking about the idea that when the child's emotional needs are not matched by the response from the parent, it leads to symptoms. What we're also trying to say is that if the patient's needs are not matched by the therapist's responses, it would lead to worsening of symptoms. That's what we are trying to say. So that's something which you should always keep in mind. When we talk about parent-child, we are talking about therapist and the patient too. Lacan, no, in fact, this idea that parent-child equals therapy, therapist-patient is the backbone of analysis. It comes from Freud's idea of repetition compulsion. Repetition compulsion is simply the idea that what you experience in your childhood gets repeated. For example, if you were abused by your parents or who were around you in childhood, later, no matter how hard you try to avoid it, you would find yourself ending up in relationships where you get abused. That's the idea of repetition compulsion. And Freud's idea is that unless you make the person aware of this, unless you make it conscious, the person would unknowingly continue to repeat the childhood experience. Like, for example, this is not a major magical idea. This is something which we all experience. So, for example, if you are a person who have always thought that I try to help everyone, but when I need some help, people do not come to help me. I'm always alone when I need help, but when somebody else needs help, I'm always there for them. And no matter how many times you change the people around you, change the kind of relationships that you get into, change the kind of friendships that you get into, you would still find yourself in the same kind of dilemma. Like you had, let's say you had this issue in school, you tried to help all of your friends, but when you had an issue, none of your friends were available for support. And when you got out of the school and got into the college, you thought, let me have a different set of friends and I will try new type of friends so that I wouldn't get into a similar kind of situation. But give some time in college, you would find yourself in the exactly similar situation with different set of friends. That's the idea of repetition compulsion. You would find the same theme repeating in your life. And that was Freud's idea. You need to get the person to understand this, to be able to look at this. And once it is looked at, it becomes easy for the person to handle. Lacan is considered as he's from France. He's considered as a bit crazy by some. He's considered as extremely smart by some others. Lacan's idea is that if you look at the person's language, you would understand the person's unconscious. So his famous statement is that the unconscious is structured like language, which also mean one of the meanings of it is that you analyze the person's language, you would understand the person's unconscious. We will discuss a bit about that in today's presentation. Of course, today's presentation is only an introduction. I wouldn't be able to cover the entire span of the thing, but yeah, some bit of it at least. Mitchell is so this is the latest school of thought in psychoanalysis. Mitchell kind of started thinking about this in early 80s. 1983, I think, was the first book that he wrote. And it's been quite popular now in the US. I think that's the most popular form of psychoanalysis now. So that's called the relational psychoanalysis, and sometimes also called the intersubjective psychoanalysis. Now there are minor differences between relational and intersubjective. I'll come to that. But the major idea which Mitchell talked about is that till now we have been thinking that the analyst knows what is wrong with the patient, and we are trying to dig into the patient's unconscious to find what is wrong. And we find that this is wrong, and we show it to the patient becomes all right. Mitchell is saying you can never know. It's not like we are trying to dig and find a truth. So Mitchell's major idea, which actually Lacan also had talked about, Mitchell's major idea was to say that we are not discovering truth. We are not discovering what is in the person's unconscious. We are inventing it. We are creating it in the presence of the patient. We are creating it together along with the patient, which is probably not an easy idea to talk about. It came from postmodernist ideas, which is popular, I think, in other social sciences, in sociology, anthropology, I think, also quite a lot in literature. The postmodern idea is that there is nothing called truth or reality. All truths are subjective. There is nothing called an objective truth. So you cannot objectively say this is what is wrong in your unconscious, or this is what's happening in your unconscious. It is a subjective perception of you as a therapist. But if it works for the patient, then it's fine. That's the only yardstick. Is it making sense to the person? If yes, it's fine. Intersubjective is an offshoot from Mitchell's approach, who kind of rejects the idea of personality. They say it's all about context. So you have to make the person understand the context in which his behavior appears or disappears. That is to say, for example, I'm talking to you in this way. Of course, this is not the way I talk to my colleagues here. And this is not the way I talk to my patients, for example, or to my partner or family, for example. So that's, that's the idea, that you do not have a fixed personality. It is all about context. Now, there have been some criticism towards Mitchell's approach and intersubjective approaches to say that there is the unconscious is the place of unconscious in their approach is not very clear. Now, I'm not getting too much into all of those theoretical stuff. So this is a broad overview. So we look at it. If you look at psychoanalysis in general and how it works, people have theorized it in two ways. One is the idea of that you provide insight to the person. That is the cognitive idea, that you say, see, this is what you're repeating from your childhood, and this is how it is connected to your childhood, and the person gains an insight, and then everything falls into place. Things are all right. So that is one group of analysts who have given a lot of importance to insight. The other group of analysts have given a lot of importance to the relationship. They look at the practice of analysis as reparenting, which is what I talked about earlier. So you become a parent for the patient. So you're always looking for the child in the other person, and you're acting as if you're a parent. Like, for example, sometimes couples would come in and they would start talking about each other. They would say, he did this and then she did that, and they would complain about each other, and it would appear to the analyst. Now, it might not appear to us right now, but when we are in that kind of a situation in the session, it might appear like siblings are coming to complain to the parent. Like brother and sister would complain about each other to the parent, and then the parent has to kind of mediate the conflict, reassure both of them, tell both of them that you both are my children, but you need to do this and that, and that is the therapist's role. Then you become a parent. You kind of calm them down, you reassure them, you respond to their anxiety and stuff. So both these aspects have been talked about, and there have been plenty of conflicts between these two groups. A group of analysts who said insight creation is the major duty of the analyst. The other group of analysts who said insight doesn't really matter. What matters is the parenting kind of atmosphere, reparenting kind of atmosphere created in the session. Now let's take a look at each of these in detail. So we'll start with the cognitive one. Of course, in my practice, I use both. The cognitive one would mean that you are looking at providing proper interpretation. You are looking at creating an insight. Now, when we say insight, what we mean is that, you remember what we talked about, repetition, compulsion. So you're repeating something from your childhood without your knowledge. And so you are creating an insight into that fact, how your current behavior is connected to your past. And that's what we're doing. So now when you look at things from an analytic point of view, it is usually a different way of looking at things. It's a completely different way of looking at things. We have to take things literally. That's the way to look at the unconscious. Taking things literally. Now, when we usually listen to someone, like for example, you're all listening to me, but in fact you are not. What you're doing is you're comparing what I'm saying with your pre-existing knowledge and experience, and thinking doesn't really make any sense, or it makes a lot of sense. And that's the idea, right? When we listen to someone, we are listening actually to ourselves. We are comparing it with ourselves and experiences, our own experiences. And psychoanalysis, as I said, gives us a different way of looking at things. It essentially, the question psychoanalysis raises is this. Now, you would have noticed yourself doing things without you meaning to. And psychoanalysis question is, who is doing that? Like for example, instead of, you might have a slip of tongue, right? Like for example, there was a supervision session where my supervisee said, started presenting the case by starting saying Mr. M, and then he immediately, we usually use only initials because we shouldn't identify the patient. So he said Mr. M, and then he immediately corrected. He said, no, Mr. SN. And so that is a slip of tongue. So when we inquired about it, he said he was not very sure if we should present that case or another case, Mr. M. Right. So there was a confusion, and that confusion came out without even him meaning to say it. Sometimes my usual example is that you could, instead of saying wife, you say life, right? So things like that, slip of the tongue. Psychoanalysis question is, if it's not you who meant to do that, who is doing it? And psychoanalysis, that's what psychoanalysis names as the unconscious. Right? Or for example, you're forgetting to do something. You would have planned everything, but then you forget to do it. Now, if you had planned to do it, you should have done it. But so who is making you forget it? What's happening? So that's the aspect which psychoanalysis calls as unconscious. And so what we are trying to do is to explain how does these things happen. So it's not the logical, rational side of us. It's actually the emotional, the nonsensical side of us. That's the side we're trying to look at. It's easy for us to kind of say that is coincidence, that's chance. Let's just put it aside. Let's deny it. But if we start addressing that side, you would get a completely different picture of yourself, and in fact probably lead a completely different life, which is what my experience has been. When we take communication, now when I said psychoanalysis would ask you to take things literally, what it also means is that you shouldn't look at what the person intended to say. The person would have intended to say life, but he actually said wife. So you should then think about what he actually said. And we are always looking at communication as having multiple levels. For example, someone might actually be, like for example, in one of my sessions, the husband came in and the husband said, last week, my daughter gave her, and he had come for a couple of sessions, so with his wife, so this is husband and wife. The husband is saying, last week, my daughter gave my wife a tight slap. And then he had a smile on his face. And then I said, it seems like you are very happy. And he said, no, I'm not. The daughter shouldn't have done that. And so he immediately gave an explanation which you would usually expect. You said the daughter is not behaving properly and she should be trained and all of those things. But he had this smile on his face which he couldn't hide. So he was quite happy that, though he was unable to slap his wife, his daughter was. So that's the idea of looking at multiple levels of communication, body language and stuff. A mixed metaphors, instead of saying beating around the bush, if you end up saying beating around the well, maybe you would think, what does the well mean for that person? You would ask the person to free associate, ask them, what does well mean for you? Why do you think you made that slip, and things like that. And again, these are not magical techniques. These are things which we usually use in a conversation. For example, when someone makes an understatement. So if you ask your friend, did you like him? Or do you like her? And the person says, she's not beautiful, but she's okay. So that's an understatement. And you would clearly get the idea that he or she does see him or her as being attractive. So, but the person makes it in a very understated kind of tone. Or instead of saying, when you stumble, when you have, like for example, in English, if you're trying to use the word exasperate, and you're saying exasperate, you would start thinking, what happened to your ex? Your ex-boyfriend or girlfriend, and so what's happening there? You would probably inquire on those lines. Or disclaimers. Disclaimers is a usual thing. My favorite example is that saying, you would say, don't get me wrong, I'm not criticizing you, but, and then we'll give a criticism, right? So that I'm not criticizing you is like a disclaimer. So you would best disregard the disclaimer. Or so for an analyst, for a therapist, a figure of speech is something which doesn't exist. You cannot say, oh, I just stumbled, or this is just a metaphor. It's just a way of speaking. No, nothing is a way of speaking for a therapist. You are taking things very, very literally. So if the person comes in and says, I have nothing to talk to you today about, you might even say, okay, fine, let's meet next week. That's fine, right? So you take things very literally. Repetitions. These are things which you would repeatedly say. And when someone says something repeatedly, for example, something is missing from your cupboard, and then your daughter keeps saying that, no, I hadn't taken it, no. Then you would start suspecting there is something there. It's a similar thing. Stuttering, breaking off to a different topic instead of talking about, like, for example, the patient started talking about mother, and he deviated to talking about his wife. So then you would inquire. Unprovoked denials, that is, even without, like, for example, you ask, you see someone, two people coming together, and then they pass, and then later you find the person alone, and the person says, oh, she was just a friend, but I didn't even ask you. Why do you have to say it? So it's an unprovoked denial. You didn't even ask. The person is simply denying, so it raises questions. Overemphasis, when someone is emphasizing something too much. So this is what we mean. We mean when we say take things literally. Now, of course, a lot of this is coming from Lacan's ideas. So Lacan's idea, which is his reading of Freud, and which seems to be accurate to me, is that the unconscious is not something which you have to dig deep. The unconscious is something which is right there in your plain sight, but which is hidden. The usual metaphor used to explain this is like, for example, you miss something, something has been misplaced. You're not finding something. For example, you're looking for a key, and you search the whole house, you search your office, you search every word, you just can't find it. But one day, you just find it lying right in front of you on the table, covered by a paper. So it was right in front of you, and you actually even searched the table also, but you didn't find it then. So that's the nature of unconscious, he says. It's not about digging deeper and finding something deeply hidden. It's something which is simply hidden by a light paper. That's all it is. Now, the other thing is, the other route to unconscious thing is symbolic connections. That is, if, like, for example, if the person comes in and says, I was really angry at my boss for keeping me waiting last week. He had asked me to meet him at 10 o'clock, but he didn't turn up at 10 o'clock. So you might want to think, if you were late to the session as a therapist, or were you late last time? Or did you inform the cancellation late? Or something like that. So some lateness from your part. So that's how we think of ideas. I mean, that's how you try to connect things. So we're always looking at symbolic connections. We're looking at, does that mean this? And then we present it to the person, and the person can say yes or no, and that's fine. we always keep an eye on the here and now. Like, for example, this is again my usual story by Malan. This is David Malan. Malan had given a story about two partners, boyfriend and girlfriend. They were walking around in the park, and when they reached a dark corner in the park, she started telling him a story where the story was that of her dog, family dog, and the dog had gone missing for many weeks, and they were all searching for the dog. But then one day the dog reappeared with a lot of puppies. Now the question here is, why did she get reminded of this story at that point in time? That's the question. Anybody, any thoughts on that before we move on? Why did she remember that particular story? Sorry, I can't really see the chat box. If you could just say it out loud. He could have told him a lot of other stories, but why this story? I don't know what's happening here. I don't know if people are commenting on the chat box. Yeah. Anyways, so let's move on then. The idea is that she probably might have thought to solidify their relationship, to get into marriage, have babies, or something like that. So that's the idea. We are always keeping an eye on the here and now. Now, interpretation is the only technique that we use when we are talking about all of this from a cognitive point of view. Now, when we say interpretation, that's the only technique that we use in analysis these days. Now, interpretation is the idea of creating meaning, creating an explanation. Like, for example, slip of the tongue. You would then say, why did the person have a slip of the tongue? You would, like, for example, or let's say the person came late to the session. Of course, the person might give a reason for it. That is, there was a traffic block or whatever. And we are not denying that, but there could also be other reasons for coming late to the session. For example, the person was angry at you for having said something in the last session. So your idea is to create an explanation, create a reason, create a meaning for why it is happening. And that is the idea of interpretation. So you give, like, for example, the person says, I really wanted to meet my friend, and he had asked me to meet him at 10 o'clock in the morning, but I overslept. So then you would think, why did that happen? And it's not easy to find explanations. Like, for example, you might think whether this friend was a school bully, and so probably that is the reason why, you still remember those bullying experiences and you don't want to meet the person. Another way of looking at all of this is to, when we say take things literally, when there is a discrepancy between words and action, we in analysis go by the action. Like, for example, the person says, I really wanted to meet you on time, but sorry, there was a traffic block. I had to be late. Now, you wouldn't look at the words, you would look at what actually happened. The person was actually late. So that's what you would focus on. So taking things very literally in that sense. So what you're doing here is you're trying to, when we create a meaning, when we create an explanation for why you have done this, essentially make the unconscious conscious. I can give you an example for this. This is a scenario from one of the case that came up in my supervision group, one of the supervision groups. This is a person whom this is a lady who's been divorced, and she's been in another relationship for the last 5 years. But recently she found out that this man had a one-off sexual something with another lady. It was just a one-off thing. It was not an extra, and it was not a second affair for this man, but he kind of had a one-night stand with another lady. Now, her dilemma is that, and she's been in that dilemma for some time. Her dilemma is simply that she has invested quite a lot emotionally in this person, has been with him for the last 5 years. Her daughter, who is 18 years old, knows this man very well. He's all become like part of the family. And so she cannot leave him, and she would find it extremely devastating and would feel isolated if she leaves him. On the other side, she can also, she is unable to forgive the fact that he did this. So what she's actually, so she asked the therapist as to what should be done. And the suggestion given to her was to continue to think about this and not decide anything for now. But if you think about, and she was quite happy with that suggestion, but if you think about it, that's what she has been doing. She's been in this dilemma. She couldn't continue with him because she felt that he cheated. She couldn't leave him because they had a good relationship. She had invested quite a lot in that relationship. So she's been postponing the decision. She's been thinking about it till she met the therapist also. So that's what she's been doing. She's been postponing the decision, not facing the decision. So what the therapist did there when he said, think about it, don't jump into anything. He in fact was suggesting what she had already been doing, but what he did in that process was to make the unconscious conscious. The unconscious there was the fact that she had decided not to make a decision. She had decided to postpone the decision. And that was an unconscious thing, which she hadn't realized. So he just made that conscious. So now it's very clear this is what she's doing. So this is a simple example. So many a times in analysis, what we're doing is not to actively intervene. We're not going to suggest you should do this, you should do that. But what we usually do is to give a reason for why you are doing this. If you think of why people come to analysis or come to a therapist, they're saying, I'm doing this, but that's not what I want. Like, for example, I get very anxious and therefore I don't go to presentations, I don't appear for interviews. And I'm avoiding this, but that's not what I want. So I'm doing this, I'm avoiding, but that's not what I want. So you might not actually suggest what the person should do. You would only give an explanation as to why you are doing it. For example, I had a patient who would go for interviews and always fail. And when I talked to him, it seemed like his father was his hero, was his childhood hero. His father was everything for him. His father was seen as a hardworking man, provided everything that they needed. So he was seen as someone who is extremely capable. Now this man kept failing, and they both were like, his problem was not appearing for interviews. His problem was that he was giving exams for his course. It was a chartered accountancy course. And so he used to give those CA final exams, and he would fail in those exams. And his father was also a chartered accountant. So I said, your father has always been your hero. And if you actually pass the CA exam, that would mean that you both are equal. And you don't want to do that to your father. You would always want to keep your father a step ahead of you so that he would be the hero. And you failing in the exam is a way to save this, to save the hero image of your father. So it's a favor that you're doing to him. And I said that, and then immediately his face changed. He had a different mood in the session, and of course he could then go ahead and complete his CA course. So that's an example. And so you're not actively telling him what to do or what not to do. You're giving him an explanation as to why you're doing this. And so now it may be clear how the unconscious is made conscious. This was his unconscious idea that he shouldn't be destroying the hero image of his father. So I just made that conscious. In other words, you are just exposing the rules of the game. And once the rule is exposed, then you can't play that same game anymore. That's the idea. Now, we have been talking about the cognitive aspect of the analytic work, the creation of insight, interpretation, and all of that. The other aspect of it is the relational aspect, which is the reparenting aspect. That is how you relate to the person. If you ask me, more than interpretation, this is much more important. Now, the relational technique is to have an empathetic, introspective inquiry. The person's subjective sense of reality might be very different from yours, but you are not going to challenge that. It is almost like how you play with children. When you play with children, they will have a lot of fantasies, but you're not going to challenge their fantasy. For example, my daughter looks at the rainbow and she says, "Oh, how beautiful rainbow," and I don't know, maybe it's because we are closer to the South Pole. The rainbows are extremely visible and extremely clear here. So, and my wife tried to tell her, but that's nothing. It's just a misperception. These are just dust particles, and there is nothing called a rainbow. And I said, don't do that. Let her hold on to the fantasy of the rainbow, and in some time, she might learn what a rainbow is, and that's fine. Or when you play with children, for example, you might allow them to win. You might make them feel like they have won, though of course you have let them win, but you let them keep that feel, let them keep that fantasy alive that they have won over you. And so that's the way you treat your patients in analytic sessions. You would not challenge their fantasies. You would hold. It's a holding environment. That's what Winnicott would say. You're just holding their fantasies. You're just allowing them to have that space to hold those fantasies. You're not challenging them. So here what we are actually doing is we are looking at kind of a developmental fixation, in the sense that we are, like we talked about, if there is a misattunement between the emotional needs of the child and the parent, we are trying to, we are assuming that kind of a misattunement, mismatch between the parent and child is what led to the problem. So we are trying to rectify that in the relationship between the parent and child in the session. And we need, of course, someone who trusts in us. We need someone who trusts in our judgments, and that's what we try to be for our patients. So that's the idea of therapy as reparenting. We do not challenge their ways of viewing things. We just go with it. For example, I could give an example of a case where a mother with an alcoholic son, and she had a husband who was alcoholic whom she divorced, but now the son has become like 19 years old and he drinks quite a lot. He comes home, he beats up his mother, and this mother has come for therapy And she feels that she had done something. She had two ideas. One, this is probably in his genes. This is from his father's genes, and probably nothing can be done about it. Second idea was that she did not raise him properly. She used to be a short-tempered lady, so she treated him in a very bad manner when he was growing up. So this is probably an after effect of all of that. Now that was another idea she had. Now the therapist didn't actually believe in the second one, the idea that that her parenting is the sole reason for his current behavior. But she didn't challenge it. What she did was she said, that seems to be right. Now what can we do? We can't go back to the past and change it. We can't, even if you try to be a better person with him right now, it will only increase his abuses. You would only become more and more helpless. So what can we do? He has his genes, and you ended up doing this kind of a parenting. There is nothing that we can do now. We can only be hopeless about the entire situation. And then the therapist started to sit with that hopeless situation. And that led to a lot of change in the mother. And the mother then gradually started getting more and more assertive with the son and started drawing boundaries with him. But if the therapist had challenged her idea, I don't think she would have been responsive to any intervention from the therapist side. So that's what we're seeing. Sometimes we may not even agree with what the other person is saying, with what your patient is saying, but you would just go with what the patient said. So that's about the second way in which analytic work has been looked at. So that's the cognitive and the relational aspect. Now, just some practical things. Usually, again, there is a difference in the way the sessions are timed between schools of thought. Like, for example, Lacan would say you don't have to keep a fixed session. It could be a variable length of session. So when you feel that an important insight has been gained in the session, you can just stop your session there. It could be 15 minutes or 50 minutes, or 1.5 hours. But usually the other traditional analytic thing is to have weekly 50-minute sessions, that is 50, and stop your session at the 50th minute, even if your discussion is halfway, and ask them to come back next week. That's usually been the practice. The other thing is that cancellations are usually charged, which is a good way to ensure that dropouts are very less. Usually in analysis, the dropouts are extremely low. Once the person starts analysis, usually patients stick to analysis. The two most important things in learning analysis, one is supervision, that you need to take supervision from a trained person. That is to see what is the, to look at it from a purely theoretical, practical, clinical point of view. Personal therapy is to help you to look at what are your personal biases which are coming into the way you practice. So both these are complementary, and both needs to happen. These are the only two ways in which you can learn analysis, more than doing any kind of course. Of course, courses and reading and all of that helps, but supervision and personal therapy are the most important tools. I think I'm done. Yep, that's it. Sorry, I took a bit more than I thought. Yeah, I would leave it at that for any questions. Stop sharing. It's a very, should I say, dehumanized situation when we are trying to present on an online platform.
Hi, sir. I'm
Yeah.
Anaka. That was a wonderful section. Thank you.
Correct.
So,
Thank you.
I have a question that is there scientific evidence for the effectiveness of psychoanalysis?
Anyway, now when you say scientific, there are two branches of science. One is, of course, the empirical branch, and the other is the rational branch. Now, empirical research has not been used in psychoanalysis. It has been used in a different manner. Psychoanalysis has been found to be extremely effective in personality disorders, for example, in borderline personality disorder, in social anxiety disorder, in panic disorder, in depression, all of that. But you wouldn't find it in the under the term psychoanalysis. You would find it in different terms, because there is a stigma around the word psychoanalysis. People have bottled it into different kinds of bottles and sold it in different names. For example, if you look at the UK government's NICE guidelines or the American Psychological Association guidelines, which are the two guidelines which we usually follow. For depression, they say if CBT is not working within 16 sessions, you should then try a second line of treatment. I can't remember which one. And then if that's not working, the third line of treatment is short-term psychodynamic psychotherapy. And if short-term psychodynamic psychotherapy is not working, then there is no treatment then for depression. So you would find it in those terms. Like, for example, in social anxiety disorder, again, practice guidelines talk about psychodynamic interpersonal therapy, PIT, as an empirically supported form of therapy. For what is it called? Borderline personality disorder. There is evidence for trauma-focused psychotherapy and transference-focused psychotherapy and Mendelization-based treatment. Both are psychoanalytic forms of treatment. I can't remember all of the names. But this is what you would see. If you look at research, you wouldn't find the term psychoanalysis, but you would find the same thing bottled in various colors of various shapes of bottles. So that's what they're doing. So yes, there is empirical evidence, but psychoanalysis is not actually looking at empirical evidence. It's actually looking more at rational evidence, which is to say, what happens in your mind. Now, if you want me to summarize what is psychoanalysis all about, I usually use the example of the rabbit example, which is my favorite example. That is, for example, if you think of rabbit, you then think of you would get reminded of four-legged animals, white animals, or furry animals and stuff like that. Now, if you think of furry animals, furry substances, you might get reminded of a blanket, you might get reminded of someone's beard, you might get reminded of a sheep or things like that. Now, let's say if you're thinking of a blanket, a beard, let's say, and then you might get reminded of one of your uncles, then our Prime Minister, Freud, or people like that. Now, let's say this uncle had abused you sexually in childhood. Now what happens is that, let's imagine that you are disgusted by the sight of your uncle. Therefore, what happens is that you're disgusted by the sight of a rabbit. That's what happens in your brain. It gets associated. And you can see that this is the nodal theory in cognitive psychology. So with your interpretations, what you're trying to do is to get this connection from the rabbit to your uncle. That's what you're trying to do in interpretation. You're trying to bring this connection out. Now, this is what's happening in neuroscience now. Neuroscience is bringing in a lot of research support for psychoanalysis. Like, for example, there's a lot of work done by Mark Soames, who is a South African psychoanalyst. And there is a branch being developed these days called neuropsychoanalysis, which is looking at integrating neuroscience with psychoanalysis. Because psychoanalysis area is not at the level of symptoms, the level of number of symptoms and stuff. Its area is to look at what is happening in your mind. Like that story of Malan, what is happening in that girl's mind, which reminded her of this story of her dog and her puppies. And so we are trying to track that process in her mind, and that is only possible now with neuroscience. And that's what we are seeing right now. So yes, there is research support. Yeah, that's the answer. There was a question about skills in psychoanalysis. It depends on what model you're practicing. But to be frank, there are no skills in psychoanalysis. Psychoanalysis is not about you learning to practice a technique on the other person. It is about your unconscious meeting the unconscious of the other person. It's like asking. It's about human relationship. Like, for example, it's like asking, what is the best technique to win a girl's mind? There is no technique. You just have to. It's a relationship which you develop. It is what happens in that moment between the two persons. So the idea is that you have to trust your unconscious a bit. It is based on reciprocal free association. In fact, the person tells you a story, and then your mind free associates with that story, and then that is what you use in your interpretation. Now, this is not something fancy. This is something which we use every day in our everyday life. Like, for example, if you go to teach someone, or if you're talking to someone, you're always using what you are reminded of to converse with a person. You're always, you cannot go with a checklist in your hand. You are always trusting your mind, and you are always using examples that come from your mind. So this is something which we use in our daily life, and that's what we usually use. So it's more about trusting your unconscious and letting your unconscious do the work. It's not about you learning a technique and going and practicing it. Yeah. Of course, I know, there is a lot more to it, which will need a lot more time for us to get into. Yeah. Any further questions?
Sir, please explain dream analysis.
Dream, the place of dream has kind of, it was once considered as the royal road to unconscious, but I don't think, except for those classical Freudian analysts, I don't think people are looking at dreams as something which is very special. So it would again be looked at as any other material which is brought into the session. So you would then, you would think, why is the person, that's what we are always looking at. Why is the person telling me this story at this point in time? And then you interpret it based on that. For example, one of my patients in the last session of analysis talked about a dream where he was an eagle and he was looking at things from the top, and he was finding it very beautiful. And I said, your dream is summarizing our analysis, because he was in analysis with me for 2 years, and it was almost like looking at his entire life from an eagle's view, and it appeared beautiful to him then. So that's how you interpret anything, and that's how you would interpret dream material also. You would look at in what context is it being brought in. And of course, you would pay attention to the person's language, what language he or she is using. Yeah. So it's considered similar to any other material being brought in. There was a question by someone. Why is there a lot of stigma associated with psychoanalysis? I would say that the major reason is that psychoanalysis it poses a challenge, and it is quite scary. It is quite scary to believe that there is a part in you which is controlling you. We would like to believe that, if you look at, that's what we have been doing. The whole idea of modernization of man is to make us feel that we are in control. But psychoanalysis challenges that idea. So I think that's what is difficult. So that's why people run away from this, because it's scary to believe that there is a part in me which I myself cannot understand, where we are trying to control everything. Psychoanalysis is saying, no, you're not in your control. You're in control of something else. And that is quite scary for us to digest. And I think that's why there is a lot of stigma around it. It's a way of treating by focusing on the here and now. It's a way of looking at the here and now and connecting it to the past, but connecting it to the past if possible. But the focus is always on the here and now. The focus is, like, for example, if someone is telling you a story about another friend, you would always ask in your mind, why is this person telling me this story? So that's the question. Why? What is happening in the here and now? That's what we are focusing always on. Yeah. Right. Were there some other questions? I know there are some questions, but seems like we have only 2 more minutes. Sorry. Is hypnosis the same as dreaming? No, it is not. It is an altered state of consciousness, which is different from dreaming. In dreaming, you are actually asleep. In hypnosis, the person is not actually asleep. Yeah. Can we stop here? I know there are other questions, but...
Okay, sir. Thank you, sir. It was a very wonderful session. Okay, now I invite Sneha CS, second year psychology student, for a feedback.
Hello, very good afternoon, everyone. Myself, Sneha CS, coming to feedback. Sir, I like to thank you for giving us the opportunity to attend the section. First of all, for me, the section was very enlightening and relevant. And Abdul Salam, sir, you did such a great work that in a short duration of time, you covered the whole section, the whole content of the topic. And so all in all, this section was very nice, and it was for me, it was very comfortable to sit and hear the whole topic. And to me, it is going to be extremely beneficial to me in my further studies. So from my bottom of heart, I'm thanking you, sir. Once again, thank you, sir.
Thank you, Sneha. So for your kind attention, we will provide a feedback link in the comment box now. Please fill that. Okay, now I invite Ms. Sanjana, Assistant Professor of Physiology, for vote of thanks.
I would like to express my gratitude to all esteemed delegates of the webinar for their presence and contribution to make this webinar a great success. I extend my gratitude to our Honorable Chief Guest, Mr. Abdul Salam sir, to take out time from his busy schedule to grace the event. And also, we are grateful to you, sir, for sharing your deep findings and knowledge about psychoanalysis with us. So, once again, thank you, sir. Thank you so much, everyone.
Thank you, ma'am. Thank you all. Now we all can leave.